Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Morning.
Good morning.
Perfect. We're recording. Good morning, everyone. I wanted to say thank you again to Dr. Callender for the invitation. It's an honor to be speaking to such a group of people, especially thinking about all the things that have brought you guys together and how long you've been meeting. It's very special to be here today. So I am doing Kalejaiye. I am an otolaryngologist and head and neck surgeon. And basically what that means is I take care of problems in the ear, nose, and throat and head and neck. So it's more of a regional specialty as opposed to an organ system. I do a lot of different things that sometimes people don't think are in my specialty because we just do a lot of pretty diverse things. Taking care of patients with hearing loss, sinus issues, trouble swallowing, thyroid and parathyroid issues and issues with their salivary gland, and even trauma to the head and neck and face. So it's a very diverse specialty and I enjoy doing it a lot. Howard is very near and dear to me. I trained in undergrad at Howard and medical school. I did my residency training at Georgetown, and then I came back to Howard, and I'm the clerkship director for surgery, which means I work directly with the students, and that's the best part of my job after taking care of patients. So the topic that I'd like to talk about with you today is HPV-related throat cancer. And I have no conflicts of interest or anything to disclose related to this presentation. So the main objectives today is just to describe the types of throat cancers that are caused by human papillomavirus or HPV. And we'll learn a little bit more about that virus and how it's a sexually transmitted virus, but it can cause throat cancer in older adults. We'll talk about how that happens and how HPV vaccines are being used to prevent throat cancer. And then we'll talk about just things to think about if any patient is at risk for head and neck cancer and the types of things to think about to screen and catch these cancers early. So when we talk about any type of cancer, we usually put it in a certain location in the body or a subsite. The types of cancer in the throat that are caused by HPV are related to the back of the throat, a place that we call the oropharynx. I don't know if you can see my mouse here, but the oropharynx is this green place in the back of the throat. And the two most important places that the HPV virus likes to cause cancer are the tonsils here, and then the very back of the tongue that you can't see on this view of the mouth. And then you can also have cancer of the soft palate here, and then the back wall, what we call the back wall of the pharynx. So when we think about HPV-related throat cancer, we're usually talking about the back of the throat, tonsils, and base of tongue. But of course, there are other sites in the head and neck that can have cancer, more commonly places like the larynx or the voice box, also the esophagus, especially in patients who drink alcohol heavily or smoke cigarettes. And then of course, also the oral cavity or the mouth. So what's special about this area is the type of tissue that's in the back of the throat. I think we all have some experience with our throat getting inflamed, maybe when we have a cold or a tonsil swelling up. And the reason that happens is because the tonsil tissue, it has a lymphoid tissue. So it's basically like a surveillance system for anything that we encounter in our environment. And then it builds up a reaction. So that's why our tonsils or lymph nodes will often get inflamed when we're exposed to a virus or some other type of pathogen. And it basically starts off the process of our immune system to fight whatever that infection is. What's special about the tonsils and how it relates to the HPV virus is because the tonsils have these little spaces or crypts, which are basically when the tissue kind of goes in or invaginates like this. And the tricky thing is the virus tends to like these hidden crypts. So that's what makes it a little bit harder to find these cancers early, because they tend to start deep in the crypts where you can't see them at the surface. So the type of cancer that we see in the throat that's caused by HPV is squamous cell cancer. And that's the most common cancer that you'll see in the throat. It's common to me as an otolaryngologist, but in terms of other cancers, it's not the most common. It makes up just 3% of all of the cancers in the United States. But there are about 500,000 people every year that will be diagnosed with throat cancer. And of those, 20% are going to be in the back of the throat or the oropharynx, where we talked about. So most people, especially in the past, that would develop throat cancer, the reason would be because of smoking and alcohol use. But more recently, as less people are smoking and we're still seeing increasing rates of these throat cancers, we've now identified that the cause, or what's driving these throat cancers, is HPV, or human papillomavirus. And I'm just checking in. I think my, am I breaking up a little bit, or is it better now?
You're fine.
It's
Just a
good.
little
Okay.
bit there,
All right,
yeah.
I'll keep going. Now, HPV is a virus. It's a DNA virus. The reason that's important is because its genome, or its genetic makeup, looks just like the human genome, double-stranded DNA. So that gives it an ability to integrate better into our DNA when we have an infection with HPV. There are so many different types of HPV, and most of them are benign. They cause things like warts on your hands and feet. Because the virus likes skin, it likes squamous epithelium, which is skin on the outer surface of your skin, but also the lining of your mouth and throat, and also the lining of the genital region. So that's the type of tissue that the virus likes to infect, and it causes what we call warts or papillomas. And you can get transmission of the virus from any skin-to-skin contact, even a doorknob, but also sexual practices. HPV is very common, meaning at some point in our lives, most of us will be infected with one type of strain of the virus. And most of the time it's an asymptomatic infection where most people don't even notice. And most people, their immune system will clear up the infection and they will never develop cancer. But some of the subtypes are very, what we call virulent, or can lead to malignancy. And some of those types of cancers are cervical cancer, and then also cancers of the anogenital region. And now we understand also cancers of the throat or oropharynx. So when HPV causes a tumor or a wart or malignancy, we usually divide the viruses into two groups. We have like the low risk subtypes that we identify that don't usually cause cancer, but will cause warts, especially genital warts, and that is 6 and 11. And then we have the high risk types, 16 and 18, and these typically cause the cancer that we're most familiar with when we talk about HPV, which is cervical cancer, but also the anogenital cancers, and then the throat cancer. Here you see a lot of warts in the penile region and also the anogenital region. And a fun fact is that the elucidation of the potential for HPV to cause cancer, especially in the cervix, was kind of discovered by a physician called Harold Housen, and he actually was awarded a Nobel Prize in Medicine for the work that he did in understanding how HPV causes cancer. And the blueprint, or the disease that helped us to really understand it, was cervical cancer. So whenever you talk about HPV, a virus causing cancer, we always go back to cervical cancer because that is where we first understood that HPV can cause cancer, and that is how we figured out how it does it. So basically, what we see in the picture here are just normal cells. The blue cells are normal epithelium, and your skin or the lining of any part of your outer body or your inner body usually has these squamous cells, which are kind of flat and they're stacked. So that's what we call the squamous epithelium. So what happens is the virus infects the lower cells of the skin or the lining, and then it creates an infection. Most people will clear that infection, but the people who don't clear that infection, eventually the virus DNA becomes part of their DNA, and then the cells will change. So they will go from being healthy and blue to what we call dysplasia, which just means that the cells are now different. They're not cancer yet, but they're different. And then eventually they become cancer, which are these kind of orange and red cells, and then they might spread or invade, which is what cancer does. Cancer is anything that has the possibility to spread elsewhere or invade and destroy the tissues near it. So that's how the virus causes infection, but it takes a very long time for the virus to cause a malignancy. It takes about 10 to 30 years. So with cervical cancer, we had a lot of time to identify the cancer before it even started. And that's why we were able to do pap smears and keep people from getting cervical cancer from HPV. When HPV relates to throat cancer, we're now finding that HPV accounts for 70 to 90% of all of these newly diagnosed types of throat cancer in the oropharynx. So usually most of these cancers were caused by smoking and drinking alcohol, but now we're seeing that what's driving most of them is this HPV virus. And the type that is the high risk type that is the cause in most of these cases is HPV 16. So how do these patients present when we see them? Patients with HPV-related throat cancer, they often present with the neck mass. Sometimes they don't even have a feeling in their throat or throat pain or a mass. They may just present with a neck mass, which is basically a lymph node that the cancer has spread to. And then sometimes they may have something symptomatic in the throat, meaning the tumor in the throat is causing them symptoms, pain, trouble swallowing, things like that. And then sometimes they often have ear pain on the side where the tumor is. And then this just shows some scans. Here we see a big tumor in the back of the tongue, and we see it on CT here. And then these arrows are pointing to lymph nodes in the neck that are enlarged and kind of cystic, meaning that it has some hollow spaces within it. And that's kind of a characteristic of HPV-related cancer. Once it spreads to the lymph nodes, it tends to be bulky, bigger, and it tends to be cystic. So HPV is a sexually transmitted infection, so we have to always think about sexual practices when we think about HPV and how it causes throat cancer. So HPV is actually the most common sexually transmitted infection. A lot of people become infected annually, up to 14 million, but most people clear the infection without any incident and without any symptoms. But men are more than twice as likely to have an infection persist in their throat, which we think is why they're more likely to get HPV-related throat cancer. We don't understand exactly why it affects men more than women, but men are less likely to clear the infection fully, so they're more at risk. But again, it's low risk overall. Only about 1% of people are going to be infected with the high risk type that causes cancer. The vast majority of the HPV types do not cause cancer. So some of the risk factors that relate to HPV-related throat cancer has to do with sexual practices. So vaginal sex partners greater than 26, oral sex partners greater than 6, and if you have a sexual debut less than age 17, All of these significantly increase your risk of having an HPV-related throat cancer. And the lag time is usually about 20 to 30 years. So it takes time for the malignancy to develop after you're infected with HPV. So we usually see HPV-related throat cancer in older adults in their 50s and 60s. So when we think about HPV-related throat cancer, we're finding that the patients who get it are different from the patients who get cancer from smoking and drinking. So we can think of the new cancer patient as it relates to the throat as having HPV-related throat cancer, and then the traditional one having throat cancer related to smoking and drinking alcohol. So with patients who have HPV-related throat cancer, they tend to be a little bit younger. They can be as young as 40 to 59, whereas the traditional patients are usually above 60. HPV-related throat cancer affects white males more than Black males, whereas patients who smoke and drink alcohol, their risk of a throat cancer was kind of equal. The patients with HPV-related throat cancer tend to have a higher socioeconomic status. They're healthy, they take good care of their health, they don't smoke, and they only drink alcohol socially, which is different from traditional cancer patients where their lifestyle, unhealthy lifestyle, drinking alcohol, smoking is what drives the cancer. They tend to have a higher number of sexual partners when they have HPV-related throat cancer. And they also have improved outcomes, meaning that their cancer is more readily treatable when it's HPV-related, as opposed to when it's related to smoking and alcohol use. And the main treatment for throat-related cancer from HPV, it really just depends on how advanced it is. When we catch it early, that means we can often use one method to treat it, whether that be surgery where we cut it out, and we also have some robotic techniques to remove the cancer, or radiation. And then if the cancer is more advanced, we usually use more than one mode to try to control the cancer and offer the patient a cure. So that could be chemotherapy and radiation, or surgery and chemotherapy and radiation. And then sometimes if all of those things have failed, the patient may get what we call a salvage operation, which is basically kind of a last resort surgery to help them. So oftentimes, because HPV is a sexually transmitted disease and it could cause cancer, it raises a lot of questions in the physician's office. So, you know, of course, patients are wondering, is it sexually transmitted? Yes. Is the throat cancer contagious? A lot of patients will be worried that they can pass the cancer on to their partner or spouse, and the answer is no, it can't be passed on. It's not contagious in that way, but the virus can be passed between partners, but it takes many, many years to develop cancer from the virus, and it's possible that you may have different sources of the virus, meaning that it may be somebody that you may have been infected from a partner before your current partner, which is very likely. Some partners may be concerned that their spouse cheated and that's how they got this infection and that's how they got cancer. And that's not the case. It's not proof that there was infidelity, because we remember that this virus, the infection happened 20 to 30 years ago and eventually led to the cancer. And then there's a question about vaccinating children because they may be at future risk of throat cancers from HPV, and the answer is yes. And we'll talk about a little bit about why that's a good idea. And then there's always a question of, okay, should I, the patient who just got diagnosed with HPV-related throat cancer, should I get vaccinated? And we don't know the answer to that yet, but we're finding out that when we do vaccinate patients, even if they have the malignancy or the throat-related cancer already, it does help their body bring up an immune response that helps to fight the cancer. So we're starting to use it as even treatment for these patients. But let's talk a little bit about the HPV vaccine. There's a lot of vaccine information and misinformation out there. So it's good to understand what the vaccine, what vaccines are available for HPV and what we expect them to do. So we currently have 3 types of vaccines available for HPV. And if you see that they're recommended as early as age 9. And the reason that we do that is because we want to make sure that people are vaccinated before they get exposed to the virus. It's very difficult to predict sexual activities of our children and young adults. We have certain ideas or maybe certain hopes and certain rules that we may have set in place, but we all know that we're not fully aware of what everyone in our family is doing and what type of activities they may be involved in. So that's why the age is so low. It's a bit scary for parents because they feel like getting a vaccine means you have to have a talk with your 9-year-old about sexual practices, but it's not. It doesn't have to lead to a, a detailed discussion. And it's really just giving them an insurance policy to make sure that whenever they start having sexual activity, whether it's in their teenage years or in their 20s, 30s, or 40s, they have a protection that will keep them from getting cancer, not just cancer of the throat, but cervical cancer and anogenital cancer too. So basically, we have to think of the vaccine as a remarkable medical advancement that can actually prevent cancer. And I think most people would want their family members to have that protection if it was something that was available to them. So when we think about the vaccine, we remember that the original reason that it was developed was to prevent cervical cancer. And it does that with 90 to 98% efficacy, which is very good. And now, because we understand the other cancers that the HPV can cause, we've expanded the indication to men and not just women for cervical cancer, but men for the prevention of genital warts and anal cancer. And now, because we understand that HPV is what's driving the increase in throat cancers, we've now expanded the vaccine to prevent throat cancer. So these are the things that I kind of basically mentioned on the last slide, and this expansion for throat cancer came about 2 years ago. And the reason that it's important, and we may not have all of the answers now because throat cancer takes so long to develop. So, we're still studying these patients, but there's so much evidence with HPV and its ability to prevent cervical cancer. And with throat cancer on the rise, we felt that it was important that we understand that this vaccine is going to be a tool for us to fight throat cancer. And it's important because we don't have a screening test for throat cancer from HPV. For cervical cancer, we have a pap smear where we can take cells from the cervix and look at them to see if they're changing or becoming cancer, but we don't have a similar test for the throat. That's why the vaccine is so important. And it's so important for people who are at risk to receive the HPV vaccine. It has a huge potential impact. We already know that it can decrease oral infections of HPV in patients who are vaccinated. It can decrease the number of lesions that they get, and it would be very cost effective, even if it only works 50% of the time and only 50% of the people at risk took it. That just means that the burden of disease from HPV cancer is so high that even if the vaccine worked only half the time and only half the people at risk took it, it would still be of a significant benefit. So the things to think about when you're thinking about throat cancer and warning signs, we do screenings on patients. A common place where patients will be screened is at their dentist's office. Sometimes a lesion or a growth may be noted. But one important thing is hoarseness that lasts longer than 2 weeks. Sometimes people may think that their voice is changing and they just have a new voice, but hoarseness can actually be a sign of a throat cancer. So we usually say that you don't want hoarseness to last longer than 2 weeks. That's about how long a cold or a viral infection should should last before it goes away. So you don't want your hoarseness to last for too long. Another symptom or warning sign can be difficulty breathing or having a new noise to your breathing where it may sound a little bit like muffled or just very turbulent. Throat pain, of course, especially when it's on one side. Trouble swallowing, coughing up blood. Sometimes the tumor may bleed or even have a foul smell, and also losing weight. Those are kind of things that help us to identify throat cancers, especially since we don't have like a screening or a smear that we can do on the throat. So in summary, HPV is the most common sexually transmitted infection in the US. In addition to benign diseases like warts, it can also cause throat cancer, and we already know that it causes cervical cancer. The HPV vaccine is safe, and we recommend it for boys and girls starting at age 9, and also adults, depending on your risk and prior exposure to HPV. So there kind of has to be a discussion, shared decision making between the physician and the patient, especially for adults who have not been vaccinated with HPV. It's usually recommended up to your 40s, 50s, just because it takes about 20 to 30 years for you to develop the cancer. And then because we don't have like a pap smear for the throat or a good screening method for throat cancer, we're really relying on vaccination, and that's expected to decrease the incidence of oropharyngeal cancer. Although because it takes so long to develop the cancer, we won't have the full information until about 2060. And that's it. I'll take any questions.
Wow.
Thank you very much for that fascinating presentation.
Mhm.
And the floor is open for any of you to ask the question.
I have a question, Doc. Thank you
Yes.
so much. That was awesome. It was awesome. So what about endoscopy? Do you discover the virus through endoscopy sometimes?
Yeah, absolutely. In the office, we do flexible laryngoscopy where we put a camera into the nose to look at the back of the throat. Now, we don't have a screening method for it. For example, we have a screening method for colon cancer, where when you're over the age of 50 or 45, if you're at a certain high risk group, you would get a colonoscopy, even if you didn't have any symptoms. But we don't have that type of screening system in place for throat cancer, likely because it's very rare. So we don't have that kind of screening system in place. But when patients have a throat complaint that is persistent, the usual thing that will happen is their primary physician will refer them to an ear, nose, and throat doctor like myself, and then we'll take a look with the camera, and that's often how we diagnose these throat cancers. And sometimes we may be looking with the camera for a different reason, and we may identify a growth or a tumor at that time.
Thank you.
Thank you.
And thank you, Doctor. Very amazing presentation. My question is a two-parter.
Sure.
For the HPV screening, can that screening identify the type, and it looks like the most important type would be HPV 16. And then the second part of the question is, do you recommend that people have HPV screenings at the start of a new relationship?
Yeah, that's a good question. We don't have like a screening program for HPV as it relates to throat cancer. Now, with pap smears, you can have HPV testing at that time. And then also you could review a record of prior HPV infections or positivity. The thing about HPV is like it's almost ubiquitous, right? If you're engaged in any sexual activity, you've been exposed to HPV, but it's just, is it a certain subtype, and do you have an active infection? You could get an off-market, like off-label test to see if you have an active HPV infection, which some people may consider a screen, but it's not an actual screening program. It's just kind of, doing a test because you want to. But it doesn't give you a whole lot of information because those tests will only tell you if you have an active infection. Remember, most people have been exposed to HPV and most people will clear the infection. And then did I answer the second part? I'm sorry, if you could tell me the second part again.
Yeah. Did you recommend HPV screenings for new relationships?
Oh, yes, yes. It's not a recommendation just because of the way that the virus behaves. Most people have been exposed and most people clear the virus. So it's not a good screening method to kind of help you feel safe. It's really just a risk of engaging in any sexual activity because we don't have anything that protects against HPV infection. Condoms are not effective. So it's kind of a calculated risk that you take.
I have a question.
Yes.
Are you suggesting therefore that all patients from the age of 9 to 46 actually get vaccinated?
Yeah. Yes, I would say that all patients, especially children, before they're exposed to high-risk HPV with sexual practices should be vaccinated. I think with adults, depending on their level of activity and their prior exposure, it's a consideration. With adults, you would expect that most adults would have had exposure to the virus, but there's so many different types of viruses or subtypes of HPV, and they may not have been exposed to the high risk subtype yet. So that's why it's usually recommended that anyone up to about the age of 46 who hasn't been exposed to high risk HPV should get vaccinated because it could help prevent a malignancy that may show up in 30 years. So you have to kind of look at their lifespan and what their potential risk of having that future malignancy is. That risk is greater for a 9-year-old than someone in their 40s. So you kind of have to balance and think about that in deciding whether to vaccinate. But it's recommended for anyone who has potential HPV exposures in order to prevent cancer that would come from that HPV exposure.
Do other specialties recognize this as a possibility, or is it only the ENT doctors who recognize this and suggest that the patient be vaccinated?
Yeah, I think it may be, I think there's definitely a significant push from ENT because of the throat cancer, but we already know because of cervical cancer and anogenital cancers. I think what's new to a lot of people is that it's recommended for men too. I think a lot of people thought that it was only recommended for women for cervical cancer. And I think what makes people uncomfortable is because it's linked to sexual activity and it makes parents uncomfortable giving it to their children because they're children and it has to do with sex, and it makes people feel uncomfortable, like maybe it's not appropriate. But that's actually the best time to give it. You want to give the vaccine before they have those exposures. So I think that's what makes people hesitant about it.
Maya, you had a question. Go ahead, Maya.
Yes, Doctor, you are so excellent. Thank you for explaining it so well. What I wanted to know was the pap smear. Up to what age the women should get the pap smear?
Oh, I don't want to be wrong. Just because pap smear guidelines change frequently, I don't think I'm up to date on the new pap smear guidelines. But what I can do is I'll take a look while we're online and I'll see if I can find something and share with you before we're finished.
Thank you.
Yeah, and I think that it's also included relative to whether they've been vaccinated or not. And I think if you've been vaccinated, I think at the age of 60, they're tending not to require pap smears after the age of 65,
Okay.
60 to
Oh,
65.
yes, I think you're right, Dr. Callender. I'm on the cancer.gov website, and it's saying that they recommend cervical cancer screening with an HPV test alone every 5 years for everyone with the cervix from age 25 until age 65. And then if HPV testing alone is not available, people can get screened with an HPV and PAP co-test every 5 years, or a PAP test every 3 years. So it's up to age 65.
Oh, so if I'll be 75 next month, so I don't need that test anymore.
It sounds like you don't, but always good to discuss with your GYN or your primary care doctor.
Primary care doctor, okay.
Yep. Just
I have a
because
question.
it's not my area, I don't want to give the wrong advice. I'm all the way in a different part of the body.
So,
Well, let me ask you this question now.
Yeah.
It seems to me, this is my perspective,
Uh-huh.
that the disease is transmitted from men to women.
Mhm.
And it seems to me that it's really critical that the men be, on the young kids from 9 be vaccinated, even more so than the women. Because in many
Absolutely.
ways, I'm thinking that the cervical cancers are caused by the male transmitting the virus to the female.
Yes, absolutely. Absolutely. Luckily, pap smears was a major tool with decreasing cervical cancer deaths. So much that we realized that we were overdoing it with pap smears, and then some of the guidelines have relaxed a little bit. But yes, I think that is important, and it's important to understand that men are at risk, and they're actually carrying the burden of the throat cancer. It affects men more than women. So that's another reason that we should vaccinate everybody, but also understand that boys have to be included, boys and men. Absolutely.
Doctor, are there
Yes.
other throat cancers that we should be concerned about, especially like from smoking?
Yes, absolutely. Those throat cancers that come from smoking and drinking, they remain, cancers that we treat all the time. And those are the usual risk factors. Smoking cigarettes and drinking alcohol heavily. And those cause cancers from your mouth to the back of your throat, the voice box, and the esophagus where you swallow. And similar symptoms: pain, trouble swallowing, weight loss, bleeding, sometimes a bad smell or halitosis. Those would be kind of the things that can kind of like tip you off that maybe something is going on. When you see your primary care physician, they take a good look in your mouth, and also the dentist. So those are good places, but it's hard to see the back of the throat in those visits. So if you do have a complaint that's kind of more in the back of your throat, pain, trouble swallowing, better to get evaluated sooner rather than later for those kind of symptoms. And you also, when you brush your teeth at night, just taking a look around. That way, if something new pops up, you would be able to recognize it.
So I had a question about vocalists, singers. Several of our members of our group are singers. Have you noticed any tendency to get throat cancer from singers?
Not from singers, mostly people who smoke cigarettes and alcohol. Sometimes in non-smokers, we see voice box cancer in people who have reflux that's uncontrolled. We're not sure that it's what's driving the cancer, but that's what we think. So we think like chronic reflux that's uncontrolled may irritate the voice box and cause a very small percentage of those cancers. But we don't see that a lot in singers. Most often what we see in singers is what we call like benign vocal cord pathology. So they may have a hemorrhage or a little popped blood vessel on the vocal cord, maybe after using their voice in a strenuous way. They may have vocal cord nodules. You can think of it as a callus from overwork of the vocal cords. They may have a polyp, which is kind of like edema or swelling or irritation in an area of the vocal cord. So we see those kind of benign things. A lot of times they get better with voice rest and learning how to use your voice well. You guys are singers, so I know you guys train your voice, you hydrate, you practice your riffs and all of that, just to make sure that your vocal cords are well lubricated and that you don't strain your muscles. So sometimes we recommend voice therapy for our patients, and then very, very rarely we may have to do an operation to address that vocal cord pathology. But most of the time it's benign in the patients I take care of who are singers.
And vocalists, including Dr. Callender.
Yes, I know.
Doctor, I have a
Doctor.
question about chronic rhinitis.
Yeah.
The standard treatment has been decongestants, including Sudafed, and now that there's some problems associated with things like Sudafed, that it may increase high blood pressure,
Yeah.
and has a treatment changed for acute rhinitis?
Yes, we have a lot of options for rhinitis, and I almost never, I don't think I've ever prescribed Sudafed or recommended it. The oral decongestant pill. I don't think it works very well, and there's just too much of a risk, especially in my patient population. So I don't recommend it at all. We have a lot of options. There's basically two types of rhinitis. We have allergic and then non-allergic. So for the allergic rhinitis, we have a lot of options. We have antihistamine pills like Claritin, Zyrtec. Those help with the nose as well. We have nasal steroid spray, which will help with any inflammation or rhinitis in the nose, something like Flonase or Nasonex or Rhinocort. We have antihistamine spray like azolastine, which is a mast cell stabilizer and just basically prevents all of the kind of runny nose that comes from the pollen getting in your nose. And then we have something that's more not homeopathic, but some of my patients who like homeopathic things like it more. And that's just a simple saline rinse, which helps to decongest the mucosa, clear out all of the irritant, the pollen, and then open up the nose so that the patients can breathe. And then if there's a bacterial infection, then we have antibiotics. Then for non-allergic rhinitis, my patients often have this, like for example, when they go in from cold weather to warm weather and then the nose runs, when they eat and the nose runs excessively, and then they tend to have a lot of postnasal drip. So for them, we use something called ipratropium, which is, it basically dries up the nasal secretions. So I have a few options that I can use to help patients with rhinitis. And then sometimes the rhinitis is caused by something going on in the nose, like maybe the middle part of the nose or the septum is deviated and touching another part of the nose, kind of causing that irritation. So sometimes when we address that surgically, they get better. So we have a few options. And then of course, if you have rhinitis, you can use over-the-counter decongestant spray like Afrin, that kind of fast-acting nasal spray, or even like that Vapor Rub or Vicks spray. The only problem with those is you can only use it for about 3 days. After that, it actually makes the problem worse. So I tend to have a lot of patients who have been stuck on or addicted to their nasal spray, their nasal decongestant spray, and I have to work with them to get them off of it. And sometimes they're very resistant to coming off of it.
Dr. John Tatum again.
Yes.
I really enjoyed your presentation, and I heard you mention a medicine called azolastine.
Yeah, azolastine.
Azolastine, okay.
Mm-hmm.
You know, my problem is runny nose, but it goes back and forth between runny nose and stuffy nose.
Mm-hmm.
You didn't mention anything about stuffy nose.
Okay, yes. For the stuffiness, we often use something like a nasal steroid, because usually the stuffiness is in reaction to something. So the nasal steroid will help kind of dampen that inflammation and help with the stuffiness. And then sometimes if the stuffiness doesn't improve, then we have surgical options to kind of open up the inside of the nose and make it easier to breathe so it's not as stuffy or congested.
Yeah, well, my situation is it goes back and forth between the runny nose and the stuffy.
Well, maybe you need to see me as a patient. And we can help you sort it out. Yes,
Yeah. I have a question, doctor.
yes.
You talked about the tonsils. Now I have the
Mhm.
tonsils. It
Mhm.
has never been removed. So am I at some great danger for all this stuff or what? I'm 75 years old and I do
No.
get pains, during winter time and it hurts. So I take that throat lozenges and
Mhm.
all that stuff.
Yes. No, you're not at risk. These cancers are rare. And we're not advocating that everyone remove their tonsils. But if you have any throat pain that lasts for more than 2 weeks, that's definitely a reason to check it out. But something that goes away with, a throat lozenge isn't usually a concern.
Okay, thank you.
Mr.
If
Buchanan, oh, you're unmuted.
if anybody
Yeah.
needs a ENT specialist and they want to seek you, how would they get in touch with you?
Yeah.
Oh, sure. My office appointment line, this is for my front office, is I can leave the number. Maybe I should put it in the chat. It's
Yes.
202-865-1432. Let me see if I can find the chat box.
While you're looking for that chat box, I got one word for you, and I'd like to hear your reaction to it. CPAP.
Okay. CPAP. Okay. Yes, CPAP is good. We use it for management of sleep apnea. I'm not the primary treatment physician for patients with sleep apnea, but I have a lot of patients with sleep apnea because sometimes I treat them with surgery. So a lot of times patients will come to me after getting a sleep study that shows that they have sleep apnea. Now, the gold standard treatment for sleep apnea is the CPAP machine. And what that does is it gives you positive pressure in your nose and mouth while you're breathing to make sure that your airway doesn't collapse. So it's good. Most people may not enjoy wearing it, and they may look for other solutions that may help. Sometimes I can help by doing a nasal surgery or a throat surgery to open things up so that the breathing is a little easier and the airway doesn't collapse while you sleep. Sometimes some people may get an oral appliance that will bring the bottom jaw forward like this while they sleep, so that there's less obstruction of the airway. And sometimes patients who aren't obese can get a implant which will stimulate their tongue to be firm and not be floppy and close up the airway while they sleep. So we have a few options, but CPAP is the gold standard and it's relatively, safe and easy to use. It's just that most people don't find it comfortable enough to use it consistently.
Doctor, give me the last 4 numbers of your phone number.
Yes, 202-865-1432. I'm putting it in the chat now.
I am too.
Oh, thank you.
I got it in.
Yeah.
Okay, perfect.
Doctor,
And
I
I
have
just
a
put my
question.
office number.
I have a question about the sleep apnea. My husband uses something, but insurance doesn't cover. They put something like you said, put that, and then he had to go do something in the throat for about a couple of weeks till it gets, and he's comfortable, but insurance didn't cover for it.
Yeah, unfortunately, that is the case sometimes. They don't usually cover for the oral appliance. The throat surgeries that I tend to do tend to be covered, and the nasal surgeries, but I know that the oral appliance isn't usually covered. It's made in the dentist's office. Some people may try like an over-the-counter one, but it's not the same as having a custom fit. So yeah, unfortunately, they don't tend to cover that.
I have a question.
Dr. Atto, you
Yes.
want a question?
Yes. Thank you very much. I enjoyed your presentation very well. Thank you,
Thank you.
Dr. Adedoyin. I have a very simple question, very fundamental. I'm kind of excited in learning about the implications of tobacco and drinking in these cancers. Is there any any contribution to these factors by the environment?
Yeah, I can't. The pictures.
Okay, like occupational exposure, or
Yes. These environmental pollutants, do they aid in the proliferation of these cancers?
Okay, that I'm not sure about those cancers. I haven't read anything that links it to like environmental things like pollutants, like air pollutants. We do know that there's occupational exposure, like from heavy metals, wood dust, and other things that can cause cancer in the head and neck. But those are mostly occupational exposure, not your regular living in a city with air pollutant exposure. I think we understand those to be more linked to respiratory illness, and the link isn't quite there yet for head and neck cancer. Although, does it cause sinusitis and inflammation in the nose? Absolutely. But I'm not sure that the evidence shows a direct link with malignancy yet.
Okay.
Thank you very much. Are there any other questions?
No, but I want to say thanks so much.
Thank you.
Yeah, thank you very much. Thank you.
Well, thank you very much, Dr. Kalejaiye. We all learned a lot from you, and we look forward to you and your career moving forward as it already has. And I hope that there are those who may want to take advantage of your expertise and your brilliance.
Yeah,
But
thank you.
you so much.
Thank you. Thank you all for having me.
Okay.
All right, take care.
All right, bye. We probably have about 10 or 15 minutes. We want to go through some of the articles. John? Well, this is an interesting article, 5 tips to stave off dementia as you age. And since we have accepted the option of living, we are aging. So and this is an interesting observation, how dementia is really rising. Is expected to be tripled by 2050. And so the question is, what can we do as we age to prevent dementia? And this article identifies five ways, and you can scroll down, John. It starts off number 1, it's interesting, physical activity. It's amazing, no matter what you read about an ounce of prevention, exercise is always one of the first things that they talk about. And here again, the same thing. Physical activity is one of the most important modifiable risk factors. And of course, they still are recommending a minimum of 150 minutes per week, minimum. And then next, of course, diet, which is commonly pointing out the importance of a plant-based diet and reliance on fruits and vegetables over meats. That's number 2. And then, of course, third is hypertension, pointing out that the antihypertensives may decrease the likelihood of developing dementia. And to have uncontrolled hypertension is something that increases the likelihood of dementia. And then, of course, smoking, which we all know, but sometimes we forget about the risk of secondhand smoking, which is being in the room with those people who are smoking. And sometimes they don't get it, but you get it. So that secondhand smoking is a concern. And then heavy drinking is also noted to produce dementia. So these are some of the things that, and of course, I guess another thing that they haven't mentioned yet, but should be included is sleep. Sleeping 7 to 9 hours a night, which is an important aspect of the prevention of dementia as well. Any comments or questions about these 5 steps to prevent dementia?
Dr. Callender, we got this list of things that you can do to help stave off dementia. But my question is related to things like COVID, which are causing dementia, and the fact that we're living longer nowadays.
I don't understand. Was that a question or a comment?
Yeah, let me get that question out. The question out is living longer a reason why more people are getting dementia?
Probably, and that's why they're identifying these 5 factors that would decrease the likelihood of dementia. Unfortunately, we don't have any successful treatment for dementia. And so one of the best ways is to prevent it rather than to deal with it. That's one of the saddest aspects of dementia, is that we don't have an effective treatment for dementia. And so an ounce of prevention is one of the best things we can do. But yes, COVID is also adds to dementia, increases dementia as well.
You know, that has been an assumption that lifespan is increasing, and it did from 1980 to 2019. But the last couple of years, lifespan has been decreasing.
Yeah, especially because of COVID. Yeah. Mm-hmm. Yeah, and as a matter of fact, there's an article that we had that looked at the decline of life expectancy. This is an interesting article as well. It talks about 6 seemingly harmless habits that pack on the pounds, and these hammer in some of the points that have been made before. I guess diet sodas looms large, and these fad diets loom large as well. But number one that they seem to harp on is the drinking of diet sodas as you scroll down. And I think that there's so many articles that substantiate that is not worth saying much about. And those of you who still drink diet sodas, it's interesting that diet sodas still are the number one drink in most of the sodas, in spite of the fact that there's alarming evidence that diet sodas are harmful. Interesting, eating with others is thought to be an additional obstacle, kind of suggesting that you eat more when you're eating with others because they're eating more. And then these diets that, yeah, John, you had something?
Yeah, people get together and try to out-eat each other.
They talk and they eat. They talk and they eat.
Yeah. And these diets, and then you stop eating, then you eat twice as much. And so then eating off a large plate that nutritionists have counseled us about. And now this is something that it's interesting. Using phones, tablets in the bed. I didn't know that would cause increase in weight, but apparently the hormones, as a consequence of the blue light, increases your appetite.
And the commercials too.
Yeah. Then sleeping in a warm room, they say, as well. So these are things to keep in mind as we recognize the closer your BMI is to 25, the better off you are. Now this is fits along with what Darryl was talking about, that the declines in the United States cardiometabolic health is striking, and it's worsening all the time. COVID didn't help with its isolation and increasing adiposity. But the fact that over 2 decades, the striking drop in cardiometabolic rate is very disturbing and frightening, and it fits with the fact that the lifespan has dropped over the last 3 years. And this is what they point to: the adiposity, high BMI, the blood glucose levels rising, high blood lipids, high blood pressure. All of these things cause early demise of patients. It's interesting, the 25 to 30 is the difference between the normal BMI and being overweight. And probably very few among us who are 25, Darryl and a few others. But that's the optimal. And the tragedy is that over the last few years, the drop has been dramatic, suggesting that many things, including social isolation, have contributed to us being less healthy than ever before.
Hello, Dr. Callender.
Yes.
Hello. Yes, I have some a question on this eating habits. Some people like to eat because they are hungry and their body needs food. Some people, on the other hand, adhere to the fact that you must eat 3 square meals a day, and in between you'll be eating some snacks and stuff. Somebody like me, I only eat when I'm hungry, no matter how good the food looks like, So what is your take on this eating habit? Just like drinking water. People sometimes say you must drink 2 liters of water every day. I drink water when I'm thirsty. When I'm not thirsty, I can't force the water under my throat. So what is your advice on this eating habit?
Well, I think the eating habit, I think that most Americans don't know what hunger is. That's what you're doing. We often don't know what hunger pangs are.
Yes.
Because we eat. So I don't think you're forced to take 3 meals a day. But in terms of water, I think you're better off if you drink about 2 liters a day. But there's nothing magic about it. If you just drink when you're thirsty and you're okay, it's all right. But the more water you drink, for the most part, the better off you are.
Well, my take would be that blood sugar levels control appetite, big driver of appetite. So if you're eating a lot of things that spike your blood sugar, half hour later you're going to be tired. You're going to need some more fuel because you are tired, and it'll spike overeating. So like food choices, I think, are probably the most important thing you can do.
Back to that obesity questions, the apple cider vinegar pills, do they help with losing your stomach weight? Or
What was the question again?
the apple cider vinegar pills?
I don't know anything about that. Dal, do you know anything about that?
Yeah, apple cider has some beneficial effects. You know, if you're doing things like taking a pill, you're going to get it's going to be a lot more effective just drinking apple cider vinegar than a pill. And there's a surcharge for the pill because they got to make the pill. Apple cider vinegar is cheap. If you want to do that, then get the apple cider vinegar, but it doesn't. It won't erase bad food choices just taking apple cider vinegar.
Okay, very
And,
good.
and the other thing about apple cider vinegar, you have to do your research and know your body, Betty, because some people do too much and it affects the calcium in their bones.
Okay, the next article is something that we've talked about forever. The classic diet change is known to improve health. It's the same stuff that we see all the time. Identifying that sticking to plant foods and fruits and vegetables is likely to be associated with good health, whereas eating a lot of sweets, salt, is going to be just the opposite and lead to being overweight. And as Dal pointed out, the importance of the insulin, the blood sugar level and the insulin drive all contribute to ill health. And every article that we get kind of points out the same thing. That plant-based diet is the best. The question is, how many of you are willing to pay the price? And this is, as you see here, same thing that every article talks about. Same thing. And the question is, are you willing to modify your diet so that you eat healthier? And those who eat healthiest seem to live the longest. And look at what they prohibit: sweets, artificial sweetened beverages, refined flours, added oils, and solid fats. Some of the things that most of us delight in are unhealthy. So
Cookies, yeah, cookies.
Chocolate chip.
candy, yeah, right.
But
All of the
goes,
good, all the good stuff, right?
That goes back to the theory of watching those things that are white. Don't consume those things that are white. That flour, candy, cookies, pastry, those things. White. So you got the white flour and you got the white sugar. So that encompasses all that. Eliminate that from your diet, and that would be a great advantage.
White salt.
Yeah, if you would do it, right.
Don't forget white salt.
Yeah, white.
People of all colors are of value: white, black, brown, green, purple. Okay, I think that it is of merit to appreciate it's what we eat that kills us. So and I think every article that we identify says the same thing. More fruits and vegetables, less meat, or no meat. working out each day, it's interesting. All of the articles will talk about when is the best time to work out. And the best time to work out is whatever time you decide you're willing to work out. Although most people will do it in the morning, it really is important that you work out and that you take time to exercise. And if doing it at night works for you, you should do it. But most people prefer to do it in the morning. But I think that
Dr. Callender, the takeaway from this is that it's good to do it at the same time every day.
that's correct, right?
Dr. Callender, I just saw another recent study, and I couldn't do a link to it because it's a subscription, and so I had to make a PDF, but I'll send it for next week. But
Oh,
it
good.
was saying that they did a controlled study where women had the best benefit from reducing waistlines and increasing lean muscle mass by exercising in the morning, and men had the best result for reducing hypertension and cholesterol by exercising in the evening.
Okay.
Dara, what is that healthy waistline again? 35?
I don't know.
It's 35. I forgot the inches. 35 and something.
Yeah, I don't know.
Yeah.
It's around that.
All I know is that I'm a BMI 21, so I never have to worry about any of that.
Okay. Now, this is an interesting article because everybody wants to know what's the least amount of exercise you need to live longer. And you can see here that as you scroll down, you'll see that they got to the point where they said that you get away with 15 minutes a day is the least that you could do and add years to life. Of course, why you would want to do the minimum rather than the maximum is another story. But anyway, but they did include that 15 minutes a day, keep scrolling down, go down. 15 minutes per day can have health benefits. Of course, that's for those who don't want to do the recommended amount, which you might think you might want to exceed rather than minimize. But there's some people who probably can't exercise longer than 15 minutes a day. I don't know what might prevent that, but there are circumstances that may exist.
Dr. Callender, you talked about it before.
Yes.
Those are the people that may be confined to a nursing home.
Yeah, being confined to nursing home doesn't mean that you can't exercise. Yeah, a lot of people confined to nursing homes are there for a number of other reasons. But I talked to one of my classmates who's in a nursing home. There's no reason for him not to exercise. But there are people who have medical issues that restrict their ability to exercise. And I think that's a point well taken.
And there are also people with mental issues who don't understand or, the benefits of exercise, and they may just not have the motivation to exercise. That's because you're capable doesn't necessarily mean that you can do it. There's so many other barriers that we have to take into consideration that may limit others from being able to do it.
Good point. Okay. Well, I don't know how many articles we need to point out that those so-called healthier drinks And of course, the reason that they're called healthier drinks in many ways, because, you know, sugar is no good for you. So you want to get liquids that don't have sugar in them. But when you substitute the artificial sweeteners for them, they cause other problems. And so it starts out as being thought of as healthier, but the data indicates that the artificial sweeteners are no good for you. But there are people, of course, who can't tolerate sugar at all. So they that's why artificial sweeteners are so popular. But in spite of that, the data supports that you substitute one problem for another. And the diabetic who cannot tolerate sugar at all is kind of caught in the middle in ways. Just like those people who can't tolerate salt and they have to take salt substitutes, often potassium products. And I think what is required is to do it in moderation to some extent. But I think many in the United States are addicted to sugar and salt. And the price we pay for that is shorter lifespans. What do we call it? We have a sweet.
A sweet tooth?
Sweet tooth.
Yeah, sweet tooth. That's what it is, sweet tooth. Yeah. Yeah.
Up with no teeth.
Well, you know, I wonder how many out of 100 actually. Well, actually, they did a study that showed that 7% of the Americans have healthy diets.
How many
So
percent?
there was a study that said 77%.
7.
I saw an article in the newspaper recently that suggested 7% of Americans have healthy diets. That's quite alarming. That's pretty low, but.
That's
Dr. Callender, a FYI observation. I was looking at some documentary was talking about, and I can't remember exactly the country, but they were talking about they have limited fresh water, clean water, and they're giving the kids, well, the families are drinking, including the kids, Coca-Cola.
Yeah.
For water.
Oh no.
So of course it was
Wow.
on YouTube. That was on YouTube, of course.
Oh no.
And the doctor that gave us the earlier discussion, and I was just thinking about the effects of those kids long term, not only their teeth, but their whole mouth and their throat and everywhere that Coca-Cola goes, because we know that Coca-Cola, one of the things that discouraged me from drinking Cokes in my early years was the fact that when I was teaching science, that Coca-Cola cleans the acid off of a battery.
Yeah, it's very good at that. But apparently there's no association of Coca-Cola and head and neck cancer. They haven't identified that yet. But
it sure eat away those teeth though.
It's caustic. Well, this is an interesting article that adds sleep to the cardiovascular health checklist, which is something that we've recognized recently, that 7 to 9 hours of sleep is good for your health.
Yes,
and less than that doesn't allow the brain to effectively drain.
Yeah. So it's
And this article points out that they've added to the other things that the cardiovascular checklist, as you see here, is sleep. And I think that in many professions, especially the health profession, getting 7 to 9 hours of sleep was not likely. But it's good to see that now it is recognized. I don't know how that's going to affect people who are in residency, but medical residency. But
Yeah, sleep is one of the most helpful things for male erectile health. So, and erectile health can be an indicator of where a man stands as far as his overall cardiovascular health.
any other comment? As you see, the thing that the 7 to 9 hours is the recommended amount of sleep. Although, as you know, and the younger you are, the more you sleep. It's interesting. But that doesn't mean the older you are, the less you sleep, because the 7 to 9 hours is still the recommended period. And of
Going
course,
back to the slide.
Say it again.
Yeah, going back to the slide before, we're talking about drinks. We're beating up on all the soft drinks and sodas, but I was just amazed that alcohol got a pass on
that. Well, because they tell you how much you can drink, and it's supposed to be healthy to drink 1 or 2 glasses for men and 1 glass for women. So that alcohol does get a pass, because they don't talk about over drinking and alcoholics, because a little wine for the stomach's sake. So that may be the reason they get a pass on that. And of course, the ENT didn't give it a pass, because over drinking is a common cause for head and neck cancer.
Dr. Callender, does post-liver transplant patients get a pass on a couple glasses of wine?
Yes. Yes. It's still healthy for liver transplant patients or non-liver transplant patients. Just have to remember it's 1 or 2 glasses. Yeah. Well, we face a lot of issues with the overturn of the Roe versus Wade situation, and those doctors who perform abortions really particularly face a lot of legal challenges, and it's going to be interesting to see what comes of that. The political ramifications are obvious, but the legal risk for doctors who still perform abortions become questionable. Whether they'll face felony charges, prison time. And I guess all of it relates to what the states decide to do about the overturning of the law. Because what it actually did was return it to the states, to make it the states' responsibility. And so each state can do its own thing if they wanted to, which is kind of a sad state of affairs, but anyway.
Dr. Callender, do you get a lot of opportunity to talk about legal issues with your brother?
Not anymore. I used to when he was practicing as a judge. but he's retired from the judgeship, so we don't talk too much about legal issues anymore. I used to though. Whenever I had legal issues, I'd call him up, and he'd give me advice.
Yeah, I'm talking about like Roe v. Wade, not your personal.
Oh, no. That's so obvious. I don't even. That's so obviously a source of difficulty for all genders and ages. That I don't even talk about that for the most part because it's
self-explanatory.
Yeah, it is kind of. And there's so many people who protesting the fact that the woman has no choice in the issue, that it's really not much of a discussion piece anymore. But for the doctors who perform abortions, it becomes a legal issue. I often wonder about the political ramifications, how the Republicans are going to be able to face it. But anyway, time will tell as the different states address it. Anybody have any points they want to make on this issue? Go ahead, Meyer. Speak.
He's muted.
Yeah, Dr.
You're on
Callender.
mute.
Hello.
Yes.
Some people, when they eat, after they or when they are eating, they keep on drinking alcohol, either beer or wine, during their meals or after their meals. And although different alcohols contain different ratios of ethanol and water, most of these people, they have high levels of alcohol dehydrogenase that metabolize the alcohol content in their drink. Now, such people, they don't need that much water. Do they need that much water? Let me rephrase it. Do they need that 2 or 3 liters of water a day? Because the alcohol they are drinking is supplying them with enough water. Whatever, in a day, somebody might drink maybe 6 or 7 or 12 beers. Do you think they need additional excess water?
I don't think alcohol is water.
Huh?
Alcohol is not water.
Yeah, and alcohol is also dehydrating.
Yeah.
So that would increase your water need if you're consuming alcohol.
Dr. Callender, I don't think you could, you heard me when I was asking question.
Yeah, you on mute. You are on mute. Right.
Oh, I
Okay.
didn't know. My husband just came and my question was when you were talking about the abortions. Now, all the doctors who are doing abortions, in Texas and all that, Mississippi, would they have to look for other jobs? Because we had a lot of doctors,
Well, each state will have to make a decision as to whether they want to make abortion legal in their state. If they make it illegal, then they will have to look for other work, right? Because it will become illegal. But if they decide that it's legal in their state, then they can continue.
Oh, and the second question, I'm sorry.
Go ahead.
And the second question is, why are these people who are not in medicine making these decisions? These are the doctors are the ones who study everything about pregnancies and everything. They are the ones who treat us. So they should be making these decisions, not the politicians.
Well, the Supreme Court has as the ultimate source of that. And they've made a number of bad decisions in the past, so they just added this to the number of bad decisions they've made. But while your point is accurate, in this country, the Supreme Court is the place where the decisions are made.
But
And
they're not doctors.
I understand that, but yeah, and that's why they make some decisions that are awful.
Mhm.
Sad. Very sad.
Elizabeth, you were asking what should the ideal waistline be? And I found a waist to height calculator that says men and women should keep their waist circumference no more than half their height. And so if you're 6 foot tall, that's 72 inches tall, your waistline should be no more than 36 inches.
Mm.
Right, I knew it was 35, but, oh, sorry, I'm on mute.
Yeah, 35 works.
It was 35, 36 thing, but I like that, half their height.
Oh, my goodness.
Oh,
Hey,
my
Betty?
goodness, right.
Betty, you got a question?
No,
Yeah.
I just kind of made a comment. Oh, my goodness. I'm 5'1", so I shouldn't have any kind of waist at all.
Okay. This is a article that I think Dr. Atone would appreciate in terms of how long does alcohol stay in your system and after you've eaten and all of that. And I think it's interesting that the ability to metabolize alcohol slows as you age. And drinking on an empty stomach. Of course, it doesn't address the issue that you mentioned relative to water intake, because to me, it's apples and oranges, alcohol and water.
There's a priority on alcohol metabolism. In other
Mhm.
words, if any alcohol that you drink, the body burns it first, and it takes first priority over food. And so the food that you've eaten, instead of getting burned up or metabolized, it goes directly to fat. And so drinking alcohol will promote more fat than if you didn't.
It's interesting. It talks about nicotine being in the blood for 1 to 3 days.
Oh,
So those are smokers have that as an issue. This is something that
yeah. This
is a crisis that we have not yet dealt with. Biden had mentioned this in his talk, but in terms of doing something specific to help the mental health crisis that we're in, so far I haven't seen anything that's been done to help it, because one of the big issues is that psychiatrists, especially around DC, and psychologists are not often willing to accept private insurances, and they often will want you to pay cash. That's harmful for many of our population. So.
yeah.
Oh,
Dr. Callender, I believe that it's going to be up to a large number of people to recognize the mental shortcomings that we have now, and not necessarily politicize it, but go to their governmental branches and let them know that the government should be funding more psychological and help, psychologists and psychiatrists. It needs more funding now, I think.
Yeah, well, the president said that, but in terms of steps taken to make it happen, they seem to be absent. And I think your point is taken that since they haven't done so, somebody needs to do so because the crisis is paid by Black and brown people.
Yes, and providers, the PPO doesn't help providers a lot, being a PPO.
No.
Yeah.
I had a quick question, Doc. Is depression and anxiety, are those considered mental illness?
Yes.
Okay. So if that's the case, yeah, we need to probably educate everybody to that fact that it's not just a feeling. It's
No, they're educated. I mean, I don't know how much more you can educate because everything I read talks about that as mental illness. So it's not so much a matter of educating as a matter of really recognizing that we need to do what you mentioned earlier to get something done about it, so that the providers are able to accept people who don't have cash as patients, and that has not been done, and also to make sure that the amount of money they pay for physicians providing mental health care is up to a standard that is so acceptable that they will be willing to accept insurance payment. Because the reason the psychiatrists and psychologists have not accepted insurance is because the money they pay is so small. And so that means that they need to increase the reimbursement for mental health issues.
Sad, very sad.
Dr. Callender, I would hate to think that the insurance companies don't provide payment for this kind of service because
Why would you hate to think that? That's a fact.
the fact is that they refuse to fund it.
Well, they fund it at a very low level, and so much so that the physicians and psychologists have decided they won't accept the low payment. So one of the ways to address this is to increase the reimbursement.
Yes, and when a provider becomes a PPO, and see, providers don't want to be PPO because of the low rate. Because when they become PPO, that means the insurance, that means they have to agree upon what the insurance is going to pay for your service. So that means if your service, if the provider cost is $300 or $200 to $300 for his session, and it's helpful to you, but the insurance company decide, well, we're not going to pay you but $10. So if the provider is charging $200 and the insurance says, if you decide to be a PPO, and we're not going to pay you but $10, that means that provider has lost $190.
Right. Yeah.
That's the crux of the matter.
Yeah.
Does the cost for that type of help that much more than medical help?
Some would argue yes, because there's an article in the Post today that talks about group therapy versus individual therapy, and it's time consuming. And so therefore, you might be able to take a blood pressure in 5 minutes, but you need to talk to a patient who's depressed and anxiety rich, maybe an hour, maybe sometimes longer. And so the amount that is reimbursed should fit the time that's spent, and it doesn't.
Okay.
Also, the education necessary to get a psychology degree is very expensive as well.
Well, it's not as expensive as a medical degree.
I was ready to say, I don't think it's any more than the
Not as
medical.
expensive as a medical degree.
Right.
Okay.
Yeah.
And
But
also,
because you have psychologists who have ED degrees, PhD degrees, and all kinds of degrees, but it's not as expensive as an MD, which they come out of medical school owing $200,000 and upwards.
I guess that's what I was thinking about. I couldn't see their education being more than medical. So, but you explained it, that you're spending more time with them. Than
Yeah, much more time, yeah. Dr. Robinson, who's one of our psychologists, talked about the fact that psychotherapy was much more valuable than medication, but it took much more time.
Yeah.
And
Yeah.
so therefore, the doctors decided to give you medication because it takes less time and it's cheaper. And so the patient gets lost because they need individual psychotherapy or group therapy, and the price. And for example, we used to have psychology-led group meetings, and of course, after a while, they stopped paying for that. So it's a vicious cycle that we find ourselves in which mental health care becomes bears the brunt of the problem because they're not willing to pay the amount of money that's necessary.
Yeah. Dr. Callender, you're so right, because, I see patients in the hospital. I'm there 3 days a week. And many of them, they said they have severe depression. They've been diagnosed with it. But the psychiatrist, when they go, they only give them the pills. They don't even say, oh, how are you? And that's it. In 1 minute, it's done.
Exactly. And years ago, this was a hidden thing.
And when they see their bill, it says they spent 45 minutes to 55 minutes with them. They said, it's only 1 minute. How are you? Okay, I'm going to write this prescription and I'll see you in 3 months.
Janice, what did you say?
Well, I agree. Years ago, depression, psychiatry, it was hidden. We kept it to ourselves.
Right.
And it's so many people out there wanting the help.
Right.
Recently, they were saying on TV, the guns are not the issues, it's the mental state of the users. And sometimes those depressed people, obsessed people, anxiety, a lot of it could be caused by COVID or many reasons. They can't get the help.
That's right. They can't.
Yeah.
That's right.
Dr. Callender, is there any relationship with the time spent and the results that you get in psychiatry?
Well, it's clear that the time you spend is helpful, but there's not an association with the reimbursement. That's where the issue.
No, I was talking about not so much the money angle.
It's
but
clear.
The result.
It's clear that the results are better if you spend more time. It's clear. It's not even worth discussing. But yes, to answer your question, it is clear that the more time you spend with the patient, the healthier the patient is going to be mentally speaking. But the reimbursement is not in concert with it.
Because you think about it, you're actually working with someone to heal their mind.
Right. And it takes time. And it was alarming to me that Dr. Robinson eloquently stated that the psychologists were not willing to spend all that time and not being reimbursed. And so they stopped accepting insurances.
Yeah, in a lot of countries, physicians are paid salaries rather than the billing system used in the United States. So, it's like somebody was mentioning about the billing would show 45 minutes, which may be a level 3 or a level 4 treatment, but they only spend 1 minute because it affects the billing. So you bill it at a level 3 or level 4 so you can get paid. And that's opposed to a lot of countries where doctors are paid salaries. I'm looking at, I did a search on, do American doctors make more money? And it says physician pay in the United States is far higher than in countries investigated, with U.S. physicians earning nearly twice as much as German physicians. In the European Union, most of the time, they're paid a salary. And so it's not depending on how much time they spend with the patient because they're going to make their salary. So, they may as well spend as much time as what's needed. If you want better medical care, the answer is not in America. It's looking at different places in the world that offer better care, where the United States lags the best care in the world. It's
Right.
not here. It's not
Yeah.
elsewhere.
That's
Yeah,
true.
right now it looks like the best medical care is going to be anywhere in the European Union, but
Right.
not here.
Right. Right.
I think of the 13 developed countries, we're at the bottom.
Yeah.
Yes.
There was an article about monkeypox, which we didn't discuss this time. Wow, it's almost 11 o'clock. But one of the things that was surprising about it was that the group that is most commonly associated with monkeypox is the male-to-male partners. And I think they said 96% of
Wow.
the
Wow.
patients who had the monkeypox were
Oh,
male-to-male partners. Anyway, so anyway, that's just the essence of the monkeypox issue.
It's called monkeying around.
Say again?
It's called monkeying around.
Oh, okay, John. Okay. Well, we've had a long session today, and I'm sorry, I didn't mean for us to go so long. It was interesting discussions on many aspects. We even had Dr. Scantlebury with us for a while. Welcome again, Dr. Scantlebury. Nice to have you with us. Yeah. And John has given us, Buchanan gives an update on his patient, Chris, who seemed to be doing very well right after the liver transplant. So,
oh,
yeah.
praise God.
Yeah, and of course we have the model liver transplant patient here, John Tatum, who's
Oh,
in
yeah.
his 29th year after
Praise God.
liver transplant. So
Wonderful.
yeah,
Good.
yeah.
Praise God.
$1 million man.
Of course, anytime you give kudos to John, you're giving kudos to Carol.
Exactly. I agree with that.
Okay. Well,
29 years. Oh,
well, you have a nice
Did you
week.
get-
See
did
you
you
again
get it?
next week.
Huh?
Any closing comments you want to make?
Yes, tomorrow will be my 70th birthday.
Oh,
Congratulations.
Happy
Congratulations.
birthday.
Young lady.
Congratulations. Keep up the good work.
Mine is Monday.
Happy birthday.
Hmm.
Okay.
Good to see our cancer survivor on.
I'll be 78 on Monday.
Oh,
praise God.
great.
Oh my goodness, ready?
Yeah, I'm getting there. I'm getting there, John.
Somebody's doing the right thing.
Doing
Anyway.
good. Very good. You're looking very nice.
Absolutely. You know,
Okay, take care. Have a great week.
Dr.
Yeah.
Callender.
Alrighty, bye-bye.
Dr. Callender, have you heard from that lady who had kidney transplant, Ramona, and the lady from Haiti, two of them.
You mean Roberta Robinson?
Robertson, yeah, and yes.
No.
Ramona used to call her. How
Haven't
about
heard from her.
Haiti? From Haiti?
Yeah. Joseph, Michelle,
Yeah.
Miss Michelle. She actually came by my office and left a note maybe a month ago, but she didn't leave a number, so I couldn't reach. But she's on dialysis and still surviving. But Roberta Robinson, I haven't heard from at all.
Okay.
And Constance Richardson, I haven't heard from recently either, although she's been hospitalized for quite a while because of her Alzheimer's. So
Right. And how about Pearline?
I spoke with her about a month ago, and she's still waiting for a transplant, and I need to talk with her and find out if she's heard from her doctor yet.
Yeah, Pearline has been on with us every day, every Thursday, except for today. I don't know where she is today.
Yeah, okay. All right, have a good week.
Thank
See you
you.
next
All
week.
right, thank you.
Dr. Callender, can I talk to you? I'll call you. Please answer. Appreciate it.
Who was that?
Velma. Dr. Scantlebury.
Oh, Velma. Oh, okay. Yeah, give me a call. Oh, you want me to call you?
Yes, please.
Okay, I'll call you.